here, this is Brad's knee that we're working on. After he had the surgery initially, they actually thought he had a pinched nerve in his low back because the pain and swelling and numbness he was actually having in his leg. And exactly what was happening is there's a nerve that comes down here called the common prono nerve. As it comes down, it wraps around the front of this leg here and then starts to travel down the front and has a couple of branches, the deep and superficial branches that go down actually into the foot and innervate the toe, when he was actually having some foot numbness. So they thought he had a pinched nerve because that nerve comes from the low back. It was actually coming from his knee. And we played with it a little bit and it seemed to give him some help. But essentially what happened is when they had the surgery, anytime you cut into tissue, you create swelling. And that swelling will bleed and it can turn into scar tissue adhesions, and that can affect the soft tissue and the nerves going through that area. They can get entrapped or irritated. So basically all through here and here, what we're doing is we're shortening his muscle tissue. I don't know if you can see that from here. But then as that muscle's contracted, we're essentially putting pressure on there and we're actually having to elongate that leg. And what we're doing is we're combing out all the scar tissue and adhesions around that nerve fiber and the muscle fibers to restore them to a normal length and to relieve all the stress on that nerve. The other one that we do is we have them toe down and then toe up, Brad, slowly. Good. And in doing this, we're actually able to restore the normal tissue health to these muscles that have been affected by the surgery. Again, this knee was replaced. Great. All right, if you have anything like this you think it might help, you give us a call or come in, 925-820-1500.